Yes, good evening, all of you. So, good evening. Finally, the anatomy is done. So, anatomy is done. So, anatomy paper 1 and paper 2 both are done. So, now it is physiology. Okay. Okay. Uh, yes. So, many are repeats. I'm very happy about it. And almost 90% direct question from offline classes, especially the RS5 and RS6. I think the students are very happy. They said they got sciatic now, and many questions. The many question directly from the offline coaching, and I think it was very helpful. Right? Yes. Charan, how was your exam? Charan, Malini, the quick news. Dora, Dora, Michael's diverticulum asked. Okay, okay, fine. Likit Balakrishna, they asked development of kidney. Yeah, development of kidney, pronephros, metanephros. Right? Okay, good. Easy paper. Likit Balakrishna, how much I like get? Liver 10 marks, sirs. Yeah. See, even I said in the offline lecture actually, liver and rectum. So both are important question because rectum is very important, and that was asked for the first time in the exam. So previously they asked about the peritoneal relations of the rectum. This time they asked in detail about rectum. Exam was good. Sayan Mandal, Virendra Patil, okay. So Malini, okay. Well done. Charan, well done. Yes, Milan, thank you. Welcome. So it's really motivating for me to conduct many classes by seeing your uh, messages. Okay, polycystic kidney they asked. Okay, Sayan Mandal, fine. Okay, that's great. Michael's diverticulum and all. Chalo, great it is. Great to see you all. Hmm. Now it is the time to discuss about physiology now. Physiology one paper. So tomorrow holiday, Sunday holiday. That means solid 48 hours time is there for you. 48 hours means around 30 hours time is there. 15 hours if you read. 30 hours time is there, and you can do better. You can do better. Be confident. Be positive. Be positive. Okay. So you can achieve any goal in your life by positive mindset. Positive mindset. All is well. All is well. I can do it. I will try level my best. This should be your attitude. Don't do any comparison. Don't do any comparison. So mistakes can happen in anybody's life. Don't do any comparison. Okay, ನಿಮ್ಮ ಲೈಫು ನಿಮಗೆ ಎಷ್ಟು ಮಾರ್ಕ್ಸ್ ಬರುತ್ತೋ ಅದರಲ್ಲಿ ಹ್ಯಾಪಿಯಾಗಿ ಇರಬೇಕು ನೀವು. ಓಕೆ, ಸೌಲ್ ಸ್ಟ್ರಿಂಗ್ ಉಲ್ಲಾಸ್, ಥ್ಯಾಂಕ್ ಯು. ಓಕೆ, so all of you just type all is well. I will try my level best. Write in the chat box. Write in the chat box, all of you. Keep writing. All is well. Even I'll write here. All is well. All is well. I will try my level best. I'll try my level best. This is the positive mindset you should have. Yeah, we can do. We can do. Don't worry. They're there to help you. So Likit Balakrishna, Basanagoda, Sayan Mandal, Soul String, Ullas. Great, great. Okay. Now today we're discussing some 10 to 20 important questions that can be asked in Physiology 1. Physiology 1. Before that, Shashank Pujar, okay, asked. Okay, Malini, good. That's great. That's great. Okay, as usual, same lines. Don't stress. Do your best. Forget the rest. Don't take any tension. Anatomy is done. Done. Dusted. Do your best in physiology. Forget the rest. Forget the rest. Okay. Yes, Basangoda. That's great. That's great, all of you. Hmm? So you can write this on your study table. Don't stress. Stress ಏನು ತಗೊಳಲ್ಲ ನಾನು. ನನ್ನ ಕೈಲಿ ಎಷ್ಟಾಗುತ್ತೋ ಅಷ್ಟು ಸಾಧ್ಯ ಮಾಡ್ತೀನಿ. ಬೇರೆದೆಲ್ಲ ಐ ಆಮ್ ನಾಟ್ ವರಿಡ್ ಅಂತ. You can write study on your study table or somewhere. You can say repeatedly the same. It will give you some confidence. It will give you 100% good confidence. Okay. Yes. Girish. Okay, Charan, great. Panduranga, fine. Okay. Now let's start with the what is the basically the distribution of topics in physiology 1. So this is for RS7. Even it is applicable for RS5 and 6 also, except this ETCOM. ETCOM is not there for RS5 and RS6. So general physiology. So general physiology 5 mark. General physiology. Neuro muscle physiology. General physiology. Okay. And basically here some easy question asked, like the compartments of body fluid compartment in the body and how to measure. So the body fluids and all, ECF, ICF and all, very simple. So and action potential, transport, active transport, passive transport, secondary transport, and easy actually. Then hematology 20. Hematology 20. So very important topic, guys. So erythropoiesis. One important topic commonly asked is hematopoiesis. Okay. Hematopoiesis. So either they can ask you erythropoiesis or leukopoiesis or thrombopoiesis. So you have to go through the hematopoiesis in detail. Very important question. Very important. Then comes is the clotting. Very important one. Clotting. All of you guys. Intrinsic pathway, extrinsic pathway, common pathway. Frequently asked. Anemia, thrombocytopenia, leukopenia, leukocytosis. Okay. Anemia, one important topic. Anemia. Then, so many questions can be asked. We'll discuss few questions here there. Then cardiovascular 25. So cardiovascular 25. Let's discuss important question later. Cardiovascular. Respiratory 20. Respiratory is 20. Neural regulation of respiration. Very important. Neural regulation of respiration. The difficult one. Abnormal breathing. Very commonly asked. Chemoreceptor. Baroreceptors. Commonly asked. Okay. Then GIT. GIT 13. I think GIT is very simple. 13. The usually asked question is the gastric juice secretion. The regulation. Pancreatic juice. Then the functions of saliva and composition of saliva. So simple question to ask. GIT. Renal physiology. Renal physiology, one very important topic is GFR. Glomerular filtration rate. The factors affecting GFR. How to measure GFR? What is normal GFR? And clinical aspects of GFR. Commonly asked. Dialysis. The mechanism of dialysis. Okay. Very commonly asked. Then comes is ETCOM. ETCOM 5 mark. ETCOM 5 mark. This is something new for the RS7. ETCOM. I think in anatomy I said the cadaver as a first teacher. In paper 1 asked. The importance of communication in paper 2 asked. Have you written? So Mohammad Saki, Basan Goda, Girish GT. ETCOM topics. 10 mark. Solid 10 mark. 5 from paper 1, 5 from paper 2. The importance of communication we discussed in last class, ETCOM class. 10 important topics. How many have you written properly? ETCOM questions in anatomy? So this is actually the distribution of topics in RGUHS. So the very important is cardiovascular. You need to start with the cardiovascular tomorrow. Then respiratory, two important topic. Then you can start hematology. So tomorrow full day cardiovascular, respiratory and renal. Or else you can do day after tomorrow as well. Okay. So one day fully for cardiovascular, respiratory and renal. Rest all one day. One day and last 3-4 hours revision. Some diagrams, important diagrams. Okay, Malini, that's great. Malini, that's great. Chalo. The first question according to me in RGVHS, this is probably the question. My prediction. Define blood pressure. Regulation of blood pressure. Okay. Define blood pressure. Regulation of blood pressure. Add a note on hypertension. Add a note on hypertension. So in exam, you need to write proper definition. Proper definition from the standard textbook. Definition. Then you can write about the normal value. Normal value you can write. Normal value. You can write about the pulse pressure. Pulse pressure. Mean arterial pressure, MAP. Pulse pressure, mean arterial pressure. Can anyone answer what is MAP? What is MAP? What is MAP? Let's see who is going to answer. MAP. Keep writing. Yes, Malini, very good. Then comes a regulation. Regulation, short-term regulation and long-term regulation. Okay, you need to write about the RAS pathway. Okay, yes. So this is what you need to write in the exam for this question. You can write about RAS pathway. You can write about the Bayer receptors. B for Bayer receptor, B for blood pressure. ADH, the action of antidiuretic hormone. What are low pressure baroreceptors? If time permits, you can write about A and P. A and P. So if you write this, if you write all this, you will get very good scoring mark. Then you need to write about the hypertension grading. Hypertension grading. What is normal? What is elevated blood pressure? What is grade 1 hypertension, grade 2 hypertension, and grade 3 hypertension are malignant hypertension. You need to write. So all of you concentrate. Yes, good. Sayan Mandal, excellent. Good, good. Okay. So this is what you need to mark, guys. So what is normal BP? 120, less than 80. This to everyone will write. Now comes is the high normal. Matlab 130 to 139. Or 85 to 89 diastolic. Grade 1 up to 160. Up to 159 grade 1. Up to 99 grade 1. Up to 180 grade 2. Up to 180 grade 2. Up to 110, that is the grade 2. Grade 3 more than 180 and more than 110. And 3 marks question. What is isolated systolic hypertension? That is more than 140, less than 90, that is diastolic. So this is very important. Very commonly asked question. Pakka question, guys. Pakka question. Hypertension grading. So normal, elevated blood pressure, grade 1, grade 2 and grade 3 and systolic hypertension. Isolated systolic hypertension. So this you need to write in the exam. All of you guys, okay? This is about the first question. Second question. Discuss in detail about uptake, transport, release of O2 from the lungs to the tissues. Asked 2 times in exam. 2 times in exam. So you need to write about the transport, especially hemoglobin, oxyhemoglobin. You need to write about the oxygen dissociation curve. What are the factors affecting it? You can write about the hypoxia as well. Can anyone tell me what are the causes of right shift of hemoglobin dissociation curve? Right shift and left shift. Let's see who is going to answer. hemoglobin dissociation curve, right shift, what are the causes? Left shift, what are the causes? Okay. Charan, very good. Charan, Shashank, Swayan Mandal, great. Swayan Mandal, great. Now, who is going to answer? Left shift and right shift. Hari Prasad is telling, sir, increase temperature. Increase temperature. Okay. So, I'll give you some 30-second time. You just think and type. Okay. Malini is telling acidosis. Swayan Mandal is telling, sir, low pH and high PCO to right shift. Increase temperature. Basangoda. Right shift, left shift. So, let's see. So, this is what you need to write in the exam. The pakka question, okay? X-axis, oxygen concentration. Y-axis, hemoglobin saturation. Labeling is important. X-axis, oxygen pressure. Y-axis, hemoglobin saturation. If you see here, left shift. So, what are the causes of left shift? Decreased temperature, decreased PCO2, and increased pH. What are right shift? Increased temperature, increased PCO2, and decreased pH. Very, very important diagram. Very, very important diagram. Try to memorize this. Charan, Charan, can you able to write this? You need to start with the hemoglobin saturation 20, 40, 60, 80 and 100, and the partial pressure 20, 40, 60 and 80, 100. So left 3 causes, so right 3 causes. And you can write about carbon monoxide as well. Okay, carbon monoxide. So carbon monoxide causes left shift. Left shift. It causes carboxyhemoglobin. So the hemoglobin has high affinity towards the carbon monoxide than the oxygen. So carboxyhemoglobin can lead to hypoxia and anoxia and death. Okay. Charan. Good. 2,3 DPG also you can write 2,3 DPG. That is what the affinity. Affinity you said good. 2,3 DPG. Good. Good answer. Good. Good. If you write, that is okay. Then one more important one. You need to write about the hypoxia. There are 4 types of hypoxia, as you know. Hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Can anyone tell me what are the causes of histotoxic hypoxia? What are the causes? What is the cause of stagnant hypoxia? What is the cause of anemic hypoxia? What is the cause of hypoxic hypoxia? Can anyone tell me? Fatapat. Fatapat, like a bullet train, you need to answer. Bullet train. Chal. Okay. So this is important one. You can just go through this. Okay. Next question. Next question from hematology. Erythropoiesis. Erythropoiesis. Very, very important. Okay. Normoblast. Intermediate normoblast. Reticulocyte. RBCs. So all this you know, pronormoblast. All this you need to write, very, very important. Shashank Puja, tissues not able to oxygen, example, cyanide poison, carbon monoxide poison, hydrogen sulfide. All these are the causes of histotoxic hypoxia. Stagnant hypoxia, the cause is heart failure. Anemic hypoxia, example, iron deficiency anemia. Hypoxic hypoxia, example, high altitude. Okay, Charan, erythropoiesis, very important. Okay. Erythropoiesis. So when question asked about erythropoiesis, you need about anemia. Anemia. You can write about anemia. Iron deficiency anemia. Vitamin B12 deficiency anemia, known as megaloblastic anemia. Aplastic anemia, because of bone marrow failure. Anemia of chronic disease. Anemia of chronic disease. And you can also write about hemolytic anemias. If you have time, you can write about hemolytic anemia, sickle cell anemia and all, you can write extra points. So very, very important concept, commonly asked in the exam. Commonly asked in the exam. Okay, anemia. Okay. Now I have a question for you. Now look at this anemia and identify what type of anemia is this. What type of anemia is this? You can see here microcytes, small RBCs, then pencil shaped cells, and hypochromia is there. The central pallor is more than 1/3. So what is this basically? So this is pencil shaped cells, and this is small lymphocyte. What is this actual anemia? You can write this in exam. You can write a diagram, histodiagram. You can write that. So you can label this all these findings. So microcytic hypochromic anemia. What is this basically? Yes, Malini, very good. This is basically iron deficiency anemia. So remember, anemia, severe anemia can lead to heart failure. Iron deficiency also causes glossitis. It also causes spooning of the nails. So many other findings. You can write that. Okay, very commonly asked in the exam. That's great. Now one more image is there for you. This is very interesting image. What we can see here, hypersegmented neutrophil. So normally 3 or 4, here more than 4. There are 5, 6 are there. Macroovalocytes. So macroovalocytes, teardrop cells are there. Large cell, megaloblast. So what is this basically? Remember, hypersegmented neutrophil. This is MCQ, very commonly asked. MCQ, excellent. Very commonly asked, guys. Very commonly asked. What is this? Malini, very good. So Malini answered, sir, megaloblastic anemia. So megaloblastic anemia, either due to vitamin B12 or due to intrinsic factor. Okay. Intrinsic factor. Can anyone tell me? Intrinsic factor secreted by which cell? Intrinsic factor secreted by dash cell of the stomach. Yes, come on guys, come on, try. This is MCQ, very commonly asked. Let's see who is going to answer. Parietal cell, Malini, very good. Parietal cell of the stomach that secretes the intrinsic factor. Not only this intrinsic factor, also hydrochloric acid that is secreted by this. Good answer, good. Okay. We can write about 2 anemia, very commonly asked, and you must know these findings. What is MCV in iron deficiency anemia? MCH, all these are the important parameters. MCV, mean corpuscular volume. MCHC, peripheral smear. What happens to serum ferritin, serum iron, and total iron binding capacity? Total iron binding capacity increases in iron deficiency anemia. Very important. Now if you write in the chat box, TIBC increases in iron deficiency. Write this in chat box. So TIBC, total iron binding capacity, that increases in iron deficiency. This is very important MCQ. Very important MCQ. And transferrin saturation less than 16%. And RDW, red cell distribution width, that is more than 14%. So if you write all this now, you will get distinction mark for sure. I'm telling you. So MCV, MCH, MCHC, peripheral smear, serum ferritin, serum iron, total iron binding capacity, transferrin saturation, and red cell distribution with RDW more than 14%. This is very important, guys. Very important. Concentrate. Yes, Sayan Mandal. Keep writing, guys. Keep on writing. Pakka question. So one question matters in exam. One main question matters exam. So to get passing mark, is 50 percentage. 150 out of 300. One longest will give you at least 5 mark. ठीक है, चलो. Charan, yes, great. This is okay. So now next question is sodium. Renal handling of sodium. Very, very important. And also remember RAS pathway and also tabuloglamular feedback mechanism. This is very, very important. This is favorite of RGUHS. The favorite of RGUHS. This GFR and tabuloglamular feedback mechanism. There is one flow chart given in Shambulingam or any book. You just go through that. Practice that. Okay, don't forget tabuloglamular feedback. Karan, are you listening? Or offline students? Charan, Shashank. Okay. Yes, PCT. Okay, PCT you said, that's fine. And not only PCT and also other parts as well. So anyway, that you can write. You can just go through the previous paper. That's okay. 60-65%, that's okay. But tabular glamour feedback, RAS pathway also you can write here. You can write about the other important related answers also. Okay, so that's okay. That's fine. Then comes is very, very important from respiratory. Neural regulation of respiration. So respiration, we have certain centers in medulla. So medulla, and we have some centers in the pons. So in the medulla we have dorsal and ventral group. Dorsal ventral group. Ventral expiration, dorsal inspiration. Inspiratory, that is muscle of inspiration, diaphragm. Pons we have apneustic center. Apneustic center and pneumotoxic center. Pneumotoxic center. Pneumotoxic center, guys. Very, very important. Okay. So this you have to write in the exam. Especially this diagram from the Shambulingam. This diagram. Okay. Pneumotoxic center. The big boss. Apneustic center. Dorsal group of neurons. Ventral group of neurons. Vagus now. So this is very, very important. All of you just concentrate. The pons and the medulla. Basically, the respiration centers are present in the brainstem. Brainstem. Okay. Brainstem. So that's great. Can you able to write this, Malini? Malini, Charan. Okay, pre-Borzinger complex. Yes. Good, good, good. Now, in exam, you need to write about the breathing pattern. Breathing pattern. So, what do you mean by eupnea? Eupnea means normal. Predapnea, tachypnea, apnea, hyperapnea, and very important is Kenny-Stokes breathing. Kenny-Stokes breathing. Very, very important. Very, very important. Whiteout's breathing. Very important. Kusumal breathing. Very important. Apneustic breathing. Very important. There are 4 important questions. So all of you just in the chat box, Bitot. After the class, you just go through this Bitot. Then Kenny-Stokes breathing. Second one, Kusumal breathing. Kusumal breathing, MCQ. And apneustic breathing. So write this in 4 words in the chat box. Keep writing. And go through this after the class. Go through this after the class. Keep writing. Malini, keep writing. Chat box, just type. Bitot, Stokes, Ben Stokes, Bitot. Okay, good, good. So Kusumal breathing occurs in diabetic ketoacidosis. Diabetic ketoacidosis. Keep writing, all of you. Apneustic also keep writing. Sayan Mandal. Apneustic. So any question asked, you can write about all the complexes and a diagram, and you can write about the abnormal breathing or breathing pattern. So eupnea means normal. Remember, eupnea matlab normal. Normal. ठीक है, Charan, good. Charan, great. चल. This we can go through after the class. हाँ, next important question. Cardiac output. Cardiac output. Define cardiac output. Mention the methods of estimation of cardiac output. What are the methods of estimation of cardiac output? And regulation of cardiac output. I think is relatively simple question, cardiac output. But in your exam, you need to concentrate on what do you mean by preload, what do you mean by preload, and what do you mean by afterload. Afterload, you need to write about this. This should be there in your answer. Preload, that is end diastolic volume. Afterload, that is resistance offered by the blood vessel. And as you know, cardiac output is equal to stroke volume multiplied by the heart rate. 5 to 6 is normal. And you can write about the heart failure. Heart failure. So heart failure, you can write right heart failure and left heart failure. You can write about the clinical features. Clinical features. And what are the factors affecting it? What are the methods? What is the common method of estimation? What is the common simple method of estimation of cardiac output? What is the common method of estimation of cardiac output? Very simple, non-invasive method. Very simple, non-invasive method. Come on, guys, come on. Let's see who is going to answer. I'm just waiting. So this is question 6, important question. So you need to write about the preload, volume of blood in the ventricles at the end of diastole. I said already, and diastolic volume. Increase volume, increase stretch, increase force of contraction. Afterload, resistance, the left ventricle must overcome. Cardiac output is equal to heart rate multiplied by stroke, stroke volume. Stroke volume. So normally it is 5 to 6 or 4 to 8 liters per minute. I think nobody has answered. Simple method, electrocardiography. Echocardiography. Echocardiography is the best, one of the easy method, right? Echocardiography. Chalo. Then comes is your HCl secretion from GIT. From GIT, HCl secretion. Gastric acid secretion. Very simple now. Can anyone answer? What are 3 phases? Fatapat, like a bullet train, you need to answer. What are 3 phases? Let's see who is going to answer. 3 phases of Malini, Ulas, Likit, 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 Kashank. What are 3 phases? Simple question. Cephalic phase. Very good. Malini answering the cephalic phase. Cephalic. Then gastric. Then intestinal. Intestinal. Can you tell me the importance, the percentage? 30, 60 and 10. Okay, remember 30, 60 and 10. Intestinal because of the gastrin. Because of the gastrin. All of you write 30, 60, 10. 30, 60, 10. Okay, just remember that. First and second and third, Sudeep, okay, gastric phase. Now I am going to show you some image here. You need to tell me. Okay, so there are three phases. Cephalic, I said 30, gastric is 60, intestinal is 10. So intestinal because of the gastrin, and gastric phase because of the long vagovagal reflexes, enteric reflexes, gastrin mechanism. Cephalic is basically because of the thought, all this, you know. So cephalic phase again. So via vagus now through the parasympathetic stimulation. So gastric phase because of all this you can write in the exam. Okay, this is a simple one. This is a very simple diagram. You need to practice. 60, 30, okay, 30, 60, 10. Good. Malini, good answer. Chalo. Now look at this very interesting image. Just to make the class interesting. That's all. Nothing else. This is my favorite. This is my Davangere benne dosa. When I look at this benne dosa, no, from the outside, my gastric secretion will increase. By thinking about that, my secretion increases. What is this phase known as? What is this phase known as? Just to make the class interesting. You know, you all tired, even me tired. Okay, everybody is in same mood, right? So what is this? Benne dosa, Davangere benne dosa, very important. Essential fatty acids, linoleic acid, linolenic acid, arachidonic acid, है ना? Good. Okay, I'm getting, sir, my favorite also, Malini. Cephalic phase, है ना? By looking at this, I'll get cephalic phase. Pavlov experiment, some are answering. Okay, very good. Now देखो, now he is having pizza. It is entering the stomach. It will stimulate the parasympathetic system. So our parietal cell will secrete HCl. Okay, by local mechanism as well as the vagus mechanism. What is this known as? Now pizza she is having. Pizza. Come on guys, come on. What is this phase? फटाफट जल्दी 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 लिखना. Cephalic हो गया. Gastric phase, very good. Gastric phase, guys, good answer. Now see, now empty plate. Now plate is empty. Plate is empty. So all everything entered our stomach. We are full now. Now this dosa and all this chutney and all entering into intestine. In intestine there is a secretion of gastrin. So gastrin stimulates 10%. So it has minor role basically. Minor role. What is this phase? Look at this now. Empty plate and empty spoons. What is this phase? Probably my thinking, my way of teaching, just to make the class interesting. That's all. Nothing else. Okay. Don't mistake me. Intestinal phase. Okay. Intestinal phase. Malini, very good. Intestinal phase. That's great. That's great, guys. That's great. I'm happy. Okay. Now the question. Now question comes is peptic ulcer disease. Very important. Peptic ulcer disease. Peptic ulcer disease. It can be of two types. One is gastric ulcer. One is gastric ulcer. Second one is duodenal ulcer. Which is common one? Which is common one? Duodenal ulcer, gastric ulcer. Especially in doctors. Especially in medical students. Because we are all in stress, no, all the time stress, reading, exam, inter-assessment, first year exam, second year exam, third year exam, stress all the time. So my question is, which ulcer is common in doctors? Which ulcer is common in medical students? First part of duodenum is affected in duodenal ulcer. Lesser curvature, that is affected. Okay, that is in case of gastric ulcer. Okay, good. Come on, guys, come on. Duodenal ulcer, very good. The first to answer by Aditi. Aditi, very good. Aditi, excellent answer. Aditi, great. Duodenal ulcer is common than gastric ulcer. Good. So what are the complications? You can write pain, bleeding. I know. So dark color stools because of the bleeding. All these are the symptoms. One more very common they asked. The drug given is pantoprazole. Proton pump inhibitors. Proton pump inhibitor. Can I name some proton pump inhibitors? Very important 3 marks question. Proton pump inhibitor. So me having benda dosa every day. So benda dosa and spicy food every day. I'm having acidity now. Very severe acidity. I'm unable to take class. Now I am taking some proton pump inhibitor. My question is, can you name some proton pump inhibitor for me? Let's see who is going to answer. Adarsh Kumar Vellur. Okay. ठीक है. Let's see who is going to answer. Because I asked once in the exam. Name 3 proton pump inhibitor or 1 or 2 proton pump inhibitors. Or mechanism of action of proton pump inhibitor in gastric acid secretion. Yes, Charan, very good. Charan, pantoprazole. Pantoprazole, very good. Lansoprazole. Okay, perindoprozole, omeprazole, rabiprazole, rabi, omi, lance, pantoprazole. All these are proton pump inhibitor. So inhibit the secretion of. HCl. Again the question asked. So it should be taken in empty stomach. It should be taken in empty stomach. Remember, not after the food, before food, 30-40 minutes before food. This is asked in the exam. Why? Intestine. ठीक है? Top seed लिखना. Okay, ठीक है. That's okay. So this is what important. All of you understood? Okay. I hope you understood this gastric acid, especially benda dosa. I hope you will get this image. Regulation. After the class, go through regulation. What are the factors affecting cephalic phase? Smell, thought. Okay. So what are the nuclei which are stimulated? How the gastric acid secreted? You can write in the tabular form. Flowchart you can write instead of in the paragraph. Then gastric phase. How gastric phase? So the food enters the stomach like that. So local mechanism, hormonal mechanism. Then the intestinal phase, gastrin and all. Then comes is the proton pump inhibitor. You can write about the duodenal ulcer, gastric ulcer complications, pantoprazole and all you can write. You can make your examiner very happy. है ना? ठीक है. Sayan Mandal, okay? So all of you say, how is the Josh, my dear students? How is the Josh? It should be very high in all the classes. How is the Josh? Yes, our offline students. Your Josh should be very high. Shashank, Charan, and others. Always it should be very high. ठीक है? Say hi, sir. Hi, sir. Very good. Swayan Mandal, very good. Chalo. This is the pakka question will come. So, next question is cardiac cycle. Very, very important, guys. So, cardiac output, blood pressure, cardiac cycle. So, very commonly asked question in the exam. Okay, very, very commonly asked. Okay. So, mention the events in cardiac cycle. You need to write about what are the events, atrial events, what are ventricular events, what is isovolumetric contraction and relaxation, and filling, rapid filling, slow filling, and all you can write. And duration, you need to write about the duration. And what are the volume changes and the pressure changes. So this is important. Volume changes, pressure changes in each cardiac cycle. Very, very important. I think this is important. Just open today Shambulingam or any book. Just read cardiac cycle. Pakka question. Either 5 marks question or 10 mark question. Question do come. And action potential. Cow. Okay. Even if I write this diagram, you will get at least 3 out of 10. If I write this diagram, proper diagram. So what are the events? And with a label diagram, only this diagram with one definition, you will get 3 out of 10. 3 out of 10. Can you able to write, Sharan, Malini, Shashank? Can you able to write this diagram? Pacemaker, okay. Pacemaker and all you can write. Check. Very simple. Ah. Next comes is ECG. ECG, very commonly asked. Electrocardiogram. Okay. Led to ECG. Led to ECG. Explain the basis of waves. Explain the basis of waves. And Inthoven's law. Inthoven's law. Can anyone answer Inthoven's law or Enthoven's law? One word answer, guys. Enthoven law. One word answer for me. One word answer. Rajji Medico, Strain, Malini, Sharan, Inthoven's law. Inthoven's law. Let's see who is going to answer. Inthoven triangle, Inthoven's law. 2 is equal to 1 plus 3. Good. 2 is equal to lead 2 is equal to lead 1 plus lead 3. Good. The first two answer is by, I think by Soyan Mandal and Straini. Straini, very good. Straini, good answer. So this is what you need to write in the exam. Okay. So you can write about this diagram as well. Okay. Leads V1, V2, V3, V4, V5 and V6. Okay. Then you have to write this diagram properly, and P wave, all these waves you have to write. But very, very important is MI. In MI, what are the abnormal ECG finding? Abnormal ECG finding. Very, very important. Not only in MI, hypokalemia, hyperkalemia. So you need to write. MI, can anyone tell me what are the MI findings in ECG? What are the findings in ECG in case of myocardial infarction, heart attack? Heart attack? Can anyone answer? Anyone? Can you answer? I will if you remember. So these 4 words you need to mug. What are they? P to T wave, ST segment elevation, Q wave formation, loss of R wave, T wave inversion. So I'm going to write here all of you guys. Increased ST segment elevation. So point number 1. So when ST segment is involved, that means myocardium is involved. When myocardium is involved, then definitely it is a very serious condition. Okay. Then peak T wave. Peak T wave. I'll have to write in the chat box. And Q-wave formation. Q-wave formation. Loss of R wave. Loss of R. And T wave inversion. T inversion. T inversion. So write this 5 points in the chat box. Compulsory. All of you write. So this is what the tombing. So this is known as tomb. So tomb means, as you know, death. When ST segment elevation is there, that means he is going to die. The common artery involved is LED, left antero descending artery, okay, which is known as widowmaker artery. So I'll write in the chat box these 5. ST segment elevation, peak T wave, Q wave formation, loss of R wave, and T wave inversion. Okay, write this, MI. Just imagine Puneet Rajkumar death, any sudden death. Remember this 5. आपको मग करना पड़ेगा, बाहर ಮಾಡಬೇಕಿದ್ನ. ST segment elevation like that. Keep writing all the fine. Malini, keep writing. All of you write. Keep writing, guys. All of you write. Sayan Mandal, very good. Write all the 5 points, not only one point. Malini, you must write all the 5 points. Shashank Pujar, Sharan, Pratik, keep writing. Manthan, are you there? Syed, लिखित बालकृष्ण, लिखित, लिखित, PQ T wave. Yes, T wave inversion. 5. So how you can remember? Puneet Rajkumar, power star. No, like this. Power star means like this. No, power star. So five important findings. 5 important findings. Aditi, good, good. Keep writing, guys. We'll go a little slow today because we have tomorrow time. Day after tomorrow is there. We'll go a little slow today, not in hurry. Let's learn few things because in today anatomy paper, almost 80 direct repeats from our classes. Almost 80 from the offline classes. Around 30-40 from the online last 15 days or 10 days classes. Very happy about it. Very happy for you. Okay. I hope you will get at least some 5-6 questions from these topics. Tomorrow one more session is there. If you get no, you will get passing mark. So that is what power findings. Okay, power findings. Good. Chalo. Okay. This is okay. So what is the most common artery involved? LAD, left antidescending artery. LAD is equal to widow artery. Widow artery. So widow ಅಂದ್ರೆ ಏನು? So ವಿಧವಾ ಅಂತ ಕರಿತೀವಲ್ಲ. So ವಿಧವಾ, ವಿಧವೆ, ವಿಧವಾ. So widow artery. ठीक है? चलो. Then comes is one question, immunity. Immunity is one important question. Okay? Immunity. Explain the role of B and T lymphocytes in immunity. So important question and very simple. Innate immunity, acquired immunity. Acquired immunity again, active and passive, right? Active and passive. So this is very simple. Immunity definition you need to write. Immunity can be innate immunity, adaptive immunity, then natural and artificial. In natural again passive and active. In artificial again passive and active. So this you need to write in the exam. This classification. This classification you must write. Then also you can write about the acquired immunity basically because of immunoglobulins. Immunoglobulins. Right? Immunoglobulins. So all of you remember the mnemonic GAMD. GAMD. Write this in chat box. GAMD. GAMD. Some student write GAMD also. GAMD also okay. GAMD also or GAMD. So the most common immunoglobulin, that is IgG1. So IgG1 is the most common immunoglobulin. Most common MC. The most heavy is the IgM. So most heavy. Heavy matlab IgM. IgM. M means IgM. M for mota. Mota hai. So the molecular weight is millionaire. 1 million is the molecular weight. Okay. So IgM is mota. IgA present in secretion. IgD it helps IgG. IgE basically in anaphylaxis. So all of you write IgM is equal to mota. M for mota. Mota matlab heavy. So it is pentameric. Pentameric. It helps in primary immune response. It doesn't crosses placental barrier. All are important MCQ. Which of the following immunoglobulin does not cross placental barrier? Your answer should be IgM. मोटा molecule. मोटा है. M for मोटा. Swain Mandal. ठीक है? Good. Then in exam you have to write about what is the role of T lymphocyte and what is the role of B cells. So remember simple funda. B cells are there, no? They're basically antigen presenting cells. They attack the invaders outside the cell. So B cell outside the cell. T cells, they attack infected cells. So when the invaders are there outside, that is basically B cell. When invaders are there inside the cell, then that cell lies by the T cell. So this is what very important one, very important. So toll receptor, toll like receptor and all, TLR and all you are going to learn in second year. So time being B cell basically outside and T cell basically inside, and B cells basically form the plasma cell produce immunoglobulins. So T cells again helper T cell and cytotoxic T cell. Okay, so T cells, so what are three types of T cells? One is cytotoxic, second one is helper T cell, and one more is there memory T cell. So memory T cell, so very important, very important. So graft rejection by T cell mediated immunity. Good. You can write about HIV. You can write about primary immunodeficiency disorders and secondary immunodeficiency disorder. HIV also you can write. Okay. So this is about immunity. Pakka question. You need to write about. So what are B cells? What are T cells? And all notes you have to write. Few points, some 5-6 points. B cells. So B cells, they develop in bone marrow. That's why B for bone marrow. T cells, they develop in bone marrow. They mature in thymus. So thymus basically T cells. Okay, you can write few points. What are cells involved in innate immunity? Phagocytes, macrophages, mast cell, neutrophil, eosinophil, basophil, NK cell, dendritic cells. So all these are you need to label. You need to write these points in exam. Phagocytosis, very important question. Phagocytosis, very important question. Okay, so this can be asked in your exam. Phagocytosis. Chalo. Done. This is about 10 important questions. Next 10 important questions. So, what is this condition? All of you guys, what is this condition known as? This is sexually transmitted disease. It affects the CD4 count. CD4 count becomes less than 1500. It leads to secondary infections like tuberculosis. What is this condition known as? The patient came with a history of diarrhea, weight loss. Then you can see loss of fat, subcutaneous fat, and you can see the tuberculosis. So this is classical condition of, what is this condition? This is known as slim disease. Slim disease andre yadu? Slim disease. What is slim disease? Slim disease is equal to AIDS. All of you write in the chat box. Slim is equal to AIDS. Write in the chat box. All of you write in chat box. Last 5-10 minutes. So next 10 questions. So these are all most expected questions. So all of you guys, so go through this. GFR very important. So GFR, How many factors are there affecting GFR in standard textbook? Charan, are you there? Charan, Malini, how many points you need to write in GFR? How many factors are there? You need to write at least few points, right? In standard textbook, around 10 to 12 points. 13 points are given. 13 points. Then coagulation, very important. Intrinsic pathway, extrinsic pathway, and common pathway. Micturition, very important. Micturition reflex, very important. Defecation reflex, pakka question. Defecation. Hypovolemic shock, types of shock. Hypovolemic shock and clinical features. Artificial respiration, and very, very important, RH incompatibility. RH incompatibility. Chemoreceptors, very, very important. Saliva and pancreatic juice, important. Lung volume and lung capacities. Lung volume and capacities, very important. So these 10 are 20 are important question. So you need to memorize all these questions properly with a proper answer from the standard textbook. Yes, Charan, are you there? So this completes your all 20 questions. So this is about the today's session, 1 hour session. So tomorrow we'll come up with one more session, some more important questions other than this. Thank you all. Happy reading and be confident.